Good afternoon, Senator Giarratana and Representative Ritter and members of the Public Health Committee. I am Donna Morundi, President of the University Health Professionals, UHP, AFT Local 3837, representing 2,600 professional, non-faculty employees at the University of Connecticut Health Center, including certified medical assistants. I am here to testify in opposition to House Bill 5129. This bill would allow medical assistants to administer vaccines under the supervision of a physician or advanced practice registered nurse and would require that they receive training and written instructions provided by such medical professionals. Medical assistants perform important ancillary functions in hospitals and outpatient settings, but they do not possess the assessment skills that nurses or physicians have honed in their years of training and delivery of patient care. Their training does not prepare them to administer vaccines. Many of these individuals have been grandfathered in because of their age and time in their careers, but have no clue of what the standard of care should be for the administration of flu vaccines. While I appreciate that the bill requires that they be supervised, there is no enforcement mechanism to be certain that medical assistants will not be acting independently. In addition, training required by this bill is, at best, haphazard. There are no uniform standards or content required. A doctor could scribble bullet points on a prescription pad, provide a thorough hands-on training seminar, and/or offer any manner of instruction between these two extremes. It creates circumstances where disparate experiences will surely develop, thereby guaranteeing varying patient experiences. Why would we legislate a lower standard of care? This is a slippery slope and will have many ramifications farther than we see at the moment. There is no emergent reason why medical assistants should be permitted to administer vaccines. In the name of patient safety, I urge you to reject this bill. Thank you for the opportunity to testify. I'll be happy to answer questions that you may have.
Thank you.
Thank you, Mr. Chair. Thank you very much for your testimony this afternoon. The pharmacists can administer the vaccines as we speak.
Yes.
And of course, we know that medical assistants cannot unless things change. In the difference in terms of training for the administration of a vaccine, I'm not talking about theoretical knowledge, I'm not talking about the drug interactions between a flu vaccine and whatever else they are taking. I get it that the pharmacists obviously know more than a medical assistant, but we're not talking about drug interactions. We're talking about under the supervision of a medical doctor who ultimately, he or she, is liable, God forbid, if something were to go wrong. So it is not, not an independent kind of a decision for the medical assistant to give the vaccine. So on the one hand, we allow pharmacists to give vaccines, yes, above the age of 18, unless we change that. But we still have so much reservation for a medical assistant to give vaccine in an office setting where by and large, the practitioner is there. Not all the time, but by and large would be there. And number two, it is the relationship between the medical assistant and the physician as to when the administration of the vaccine is contraindicated. Let's say the child or the adult comes in not feeling well, running a low-grade temperature. The medical assistant would automatically go to the doctor and say, hey, under these circumstances, take a look and decide whether the patient should get the vaccine today or not. So I'm not sure as to why there's such a pushback on the medical assistant giving the vaccine when we allow pharmacists who don't have any hands-on training, correct me if I'm wrong, in terms of administration of vaccines. As a physician, yes, you have a hands-on training. As an APRN, yes, they have done all these procedures on patients and during their training period. So on the one hand, we allow pharmacists to administer, and we have such a pushback on the medical assistants. That's the part that I'm not able to get, unless in the pharmacy training, they are taught and they administer vaccines as part of their training. Do pharmacists do that?
Pharmacists do have a small amount of training when it comes to assessing medications and the needs for medications. The problem is that medical assistants currently do not receive any of that. I think that it's optimistic at best to think that, in fact, if a medical assistant is in an office and now a patient walks in and wants a flu shot, that with no physician present, the medical assistant would not, in fact, give that flu shot. So I think that there's the ideal and then there is the reality of what this bill could actually do.
Thank you for that. I get that. And how does that differ from walking into a pharmacy and getting a flu shot? How does that differ? There's no physician there, there's no supervision there, nothing. So that limited training of a pharmacist is adequate in your mind to administer the vaccines, and we are not putting our population at risk?
I think that certainly the pharmacist, by their virtue of their training, has way more experience with medications and or illnesses to be able to make the questionable call as to whether the shot should be given or should not be given. And, you know, based on what the requirements of each particular, you know, need of the patient, I think that that's certainly a little bit more important, that the pharmacist training is so intensive.
Would you be kind enough to elaborate for the committee this extensive training that the pharmacists get and the so little training that a medical assistant gets? What is this elaborate training for a pharmacist for vaccine administration? I'm limiting itself to vaccine administration, not all the entire training in pharmacology. There's no question about that at all.
Right.
They're experts in pharmacology. That's what they do. They're pharmacists. But in vaccine administration, could you tell us what is the training they get in terms of hours, in terms of what they have done to qualify them to receive the vaccine, and then we're pushing back or holding back on the medical assistant?
Again, in many circumstances, it's the assessment ability. And the old see one, do one is probably exactly what's being practiced now by the pharmacists that are giving injections.
I want to make sure I hear that clearly. So the pharmacists are practicing see one, do one, and we are okay with that.
No, I'm not.
But
I think that
pharmacists can give.
The bill addresses training for these two positions at some future point, and we don't know what that training is. The bill doesn't elaborate on the training.
I'm sorry, I missed you. I didn't get what you just said. If you could just repeat it, I would appreciate that.
The bill does not elaborate on the training for either of these two specialties.
It does not elaborate for specialty for pharmacists below the age of 18. As the chairman correctly said, that this bill addresses
Correct.
pharmacists giving injection vaccines from the age of 12 to 18.
Correct.
So that's your concern.
Correct.
Right. But above the age of 18, you don't have concerns for the pharmacists.
Far less than medical assistants, yes.
I'm sorry?
Far less than medical assistants.
And the rationale is this elaborate training that pharmacists get for vaccine administration in their pharmacy training. Is that the reason?
I would assume that the training in their course of their 5 or 6 year program is substantially more than that of a medical assistant.
No, we are not talking about general training of a pharmacist. That is not what we're talking about. We are talking about in the pharmacy program, 4 to 5 years, the time that is spent specifically in terms of administration of vaccines and evaluating patients. That's the only part of that we're talking about. We're not talking about drug-to-drug interactions. We're not talking about the entire program. There could be PhDs too. As you said, there are more and more pharmacists nowadays are PhD. I get that. They're very knowledgeable, no question about that at all. But where do they have that foundation in administration of vaccines? That's where we are limiting our conversation to.
The specific amount of time for their training for that piece, I'm not sure of.
Okay. Would it be possible for you to get back to the committee on that component that we just
Sure.
raised as to comparing apples and apples, where we are looking at pharmacists that we as a state have allowed to administer vaccines for the fact it's convenient. I mean, people, so that our vaccination rates remain high, which is very important. And what is that in that training of them that they can administer vaccine 18 and above? And we have reservations, such severe reservations of a medical assistant under the supervision of a physician compared to a pharmacist who has no supervision at all. But this is, you're right, you're absolutely right. In that particular office, an MD may not be present, an APRN may not be present. I get that. But ultimately, they are the responsible if anything were to go wrong. But I'm not sure what happens in the situation of a pharmacy if something were to go wrong, and we would like to see if you'd be kind enough to provide us that information.
I'd be
We
glad
would
to get that
appreciate
for
that.
you.
Thank you very
Sure.
much. Thank you, Mr. Chair.